Welcome to Howard Brown Barber and Beauty Institute. Today, we will be doing the review for skin disorders and diseases. Let's begin. Many scientists and dermatologists believe that extrinsic factors such as exposure to the sun or smoking are responsible for up to blank percent of skin aging. Is it 50, 60, 75, or 85? If you chose D, 85, you are correct. It is recommended that you wear a broad spectrum sunscreen with an SPF of at least blank on a daily basis. Is it 5, 8, 15, or 30? If you chose C, 15, you are correct. A blank is an abnormal, rounded, solid lump above, within, or under the skin that is larger than a papule. Is it tubercle, mole, macula, or bulla? If you chose A, tubercle, you are correct. Which of these terms refers to thin, dry, or oily plates of epidermal flakes? Is it fissures, keloids, pustules, or scales? If you chose D, scales, you are correct. Benign keratin-filled cysts that appear just under the epidermis and have no visible openings are: is it milia, ulcers, crust, or pustules? If you chose A, milia, you are correct. An open comedo is also known as a: is it mole, birthmark, blackhead, or whitehead? If you chose C, blackhead, you are correct. Which of these is an inflammatory, uncomfortable, and often chronic disease of the skin characterized by moderate to severe inflammation, scaling, and sometimes severe itching? Is it eczema, acne, psoriasis, or herpes simplex? If you chose A, eczema, you are correct. A blank is an abnormal brown or wine-colored skin discoloration with a circular or irregular shape. Is it mole, stain, chloasma, or lentigo? If you chose B, stain, you are correct. The absence of melanin pigment in the body and skin sensitivity to light are signs of: is it nevus, lentiginous, osteotosis, or albinism? If you chose D, albinism, you are correct. What is the most dangerous form of skin cancer, often characterized by black or dark brown patches on the skin that may appear uneven in texture, jagged, or raised? Is it basal cell carcinoma, malignant melanoma, squamous cell carcinoma, or verruca cell? If you chose B, malignant melanoma, you are correct. A cosmetologist must not serve a client who is suffering from an inflamed skin disorder, regardless of whether it is infectious, unless the client needs a facial quickly for an important event such as a wedding, declares that he or she is practicing doctor-prescribed home care, has a physician's note permitting the client to receive services, signs a waiver clearing the cosmetologist and the salon of liability. If you chose C, has a physician's note permitting the client to receive services, you are correct. A skin condition caused by an inflammation of the sebaceous glands that is often characterized by redness, dry or oily scaling, crusting, and or itchiness is it contact dermatitis, irritant contact dermatitis, allergic contact dermatitis, or seborrheic dermatitis? If you chose D, seborrheic dermatitis, you are correct. The term blank refers to abnormal colorations that accompany skin disorders and are symptoms of many systemic disorders. Is it anhidrosis, bromidrosis, dyschromias, conjunctivitis? If you chose C, dyschromias, you are correct. A blank is a type of keratoma. Is it callus, keloid, lesion, or excoriation? If you chose A, callus, you are correct. Acne is a skin disorder characterized by chronic inflammation of the blank glands. Is it sudoriferous, sebaceous, sweat, or adrenaline? If you chose B, sebaceous, you are correct. A predisposition to acne is based on heredity and is it diet, age, use of non-comedogenic makeup, or hormones? If you chose D, hormones, you are correct. A non-comedogenic products are specifically designed and proven not to clog the bullous, dyschromias, follicles, or sebaceous glands. If you chose C, follicles, you are correct. People have blank over the intrinsic factors that affect skin aging. Is it no control, little control, considerable control, or total control? If you chose B, little control, you are correct. The best defense against pollutants is to: is it wear sunscreen whenever you are outside? Avoid touching your face with your hands? Follow a good daily skincare routine? Or wear long-sleeved clothing when you are outdoors? If you chose C, follow a good daily skincare routine, you are correct. Irritant contact dermatitis occurs when irritating substances temporarily damage the: is it dermis, epidermis, papillary layer, or hair follicles? If you chose B, epidermis, you are correct. A pustule is a raised inflamed papule with a white or yellow center containing blank in the top of the lesion. Is it water, blood, lymph, or pus? If you chose D, pus, you are correct. A blank is a large protruding pocket-like lesion filled with sebum. Is it closed comedo, sebaceous cyst, bulla, or miliaria rubra? If you chose B, sebaceous cyst, you are correct. A flat spot or discoloration on the skin, also known as a liver spot, is it macule, leukoderma, milia, or scale? If you chose A, macule, you are correct. Foul-smelling perspiration, usually noticeable in the armpits or on the feet, that is generally caused by bacteria is it hyperhidrosis, miliaria rubra, anhidrosis, or bromhidrosis? If you chose D, bromhidrosis, you are correct. A blank is a slightly raised mark on the skin formed after an injury or lesion of the skin has healed. Is it mole, scar, scale, or stain? If you chose B, scar, you are correct. A contagious bacterial skin infection characterized by weeping lesions is it impetigo, conjunctivitis, eczema, or herpes simplex? If you chose A, impetigo, you are correct. A blank is an itchy, swollen lesion that lasts only a few hours. Is it a wheal, a vesicle, a verruca, or a tubercle? If you chose A, wheal, you are correct. A blank is a crack in the skin that penetrates the dermis. Is it ulcer, fissure, excoriation, or crust? If you chose B, fissure, you are correct. A small blister or sac containing clear fluid lying within or just beneath the epidermis is a tubercle, tumor, vesicle, or wheal. If you chose C, vesicle, you are correct. A large blister containing a watery fluid that is similar to a vesicle is it a tubercle, a macule, a cyst, or a bulla? If you chose D, a bulla, you are correct. In the ABCDE cancer checklist, established by the American Cancer Society, what does the C stand for? Is it crust, color, caliber, or circumference? If you chose B, color, you are correct. When bacteria cannot survive in the presence of oxygen, it is known as, is it anaerobic, anesthetic, hyperkinetic, or aerobic? If you chose A, anaerobic, you are correct. UVA rays, also known as blank, are deep penetrating rays that can even go through a glass window. Is it enhancing rays, tanning rays, aging rays, or burning rays? If you chose C, aging rays, you are correct. An allergic reaction created by repeated exposure to a chemical or a substance is known as a, is it contract irritation, sensitization, non-contact irritation, or irritant contact dermatitis? If you chose B, sensitization, you are correct. An acute inflammatory disorder of the sweat glands characterized by the eruption of small red vesicles and accompanied by burning, itching skin is it hyperhidrosis, miliaria rubra, anhidrosis, bromhidrosis? If you chose B, miliaria rubra, you are correct. This concludes the review for skin disorders and diseases. Make sure that you subscribe to the channel so that you are notified when new videos come out. If you would like more information on classes and to join our community, please visit our website at howardbrownonline.com.